My name is Anna Tisler, and I am a PhD student coming from Estonia, a small country in Eastern Europe, and I will be doing my research internship in a SUNY Downstate Medical Center under Professor Hirschfeld, who is one of the three principal investigators on the HIV care adherence study called Supporting Treatment Adherence for Resilience and Thriving, or START. And the proposed project is highly significant and innovative because it's scalable to reach a broader population of people living with HIV and may be adapted to clinical and community-based settings. And the most important feature of the project is mHealth. And as I'm coming from Estonia, which was reported as most innovative country in Europe. So I believe that I can bring back knowledge from this project from US and implement experience in Estonia. In Estonia, I'm a PhD student and my main PhD dissertation topic is human papillomavirus and cancer associated with this virus. But I'm very interested in novel solutions for the healthcare system. So as I mentioned before, Estonia has been named the most advanced digital society in the world. However, while e-health is listed among the best e-solutions that have led Estonia to become one of the world's most developed digital societies, implementation of mHealth or mobile health and e-health solutions for healthcare interventions has lagged. And this is one of the main reasons I wanted to be involved in the project under SUNY. I'm a very restless student, so I do believe that an international internship is much needed and critical step toward the developmental leap for a junior health researcher. Coming from a very small country of population 1.3 million, I do believe that it's critical to go outside and experience and establish connections. It's very hard to do research internally in our country. So once I had this idea to go abroad, I asked my advisor for advice and whom she knows, where can I go? So when she recommended me to take an internship under Professor De Hovitz, as he was the one main figure in her research career who taught her a lot, and she recommended very deeply. I have been applying for the stipendium to come to New York, to specifically SUNY Downstate, for 3 years. And I've got my stipendium last year during COVID, actually, because I'm infectious disease epidemiologist, and during COVID, people awareness about infectious disease epidemiology became higher. And I guess the project made sense as well for the future epidemics. So I was chosen as a receiver of this stipendium to take part in the research project in US. It's a very interesting story because my advisor in University of Tartu, maybe 10 years ago, or actually 30 years ago, she was a student under Professor De Hovitz, and now she's my advisor, and I learned a lot from her, and she's a very wise and smart researcher in University of Tartu, and she's been doing research with HIV whole her life, and she's a very dedicated person. And once I had this idea as a PhD student, because I really believe that an international internship is much needed and critical step toward the developmental leap for a junior health researcher. So I had this idea that I shall go outside and experience outside of my country I came with my family, actually. I'm not alone. So that's a little bit more challenging than coming alone. So we came in the end of August, and New York, I've been to New York before, and I've done one semester in University of Salisbury in Maryland before, like 3 years ago. So I do love US and New York. It's like such a vibrant city, energetic, never sleeps. So this time I decided to bring my family and my kid, who goes to school in New York, and she loves it. And people are very supportive, very friendly in SUNY Downstate, and outside university we got help from everywhere, and there were no challenges except housing. It's tough, but we will figure it out, and otherwise everything is great. My internship lasts for 1 year, starting from August till July 2023. This is agreement, and I have to go back, and by the agreement I have to implement newfound knowledge and experiences back at home. And this is very important for me to positively shape the future of e-health in public health as an e-solution in Estonia. I will do that with the gratitude. And so this is important for me to go back and to help my university and my population, my country.
Necessary.